Is it dangerous to bend your spine? Do you really have to avoid bending forward for the rest of your life? It's hard not to be afraid when your doctors are like mad scientists, scaring you about disc herniations and showing you models that make you feel like your spine is fragile. These models are not accurate. I know some of you have hurt yourself trying to pick something up, and literally your legs have given out on you. So it's understandable to be afraid. But how do you think your muscles are going to respond to clenching on for dear life and moving like a robot for months or even years? Especially when the only way your discs and joints get hydrated is with movement. And if your back and core muscles are just locked up, bracing all day, how do you think that's going to affect muscle tightness, spasms, and pain? Let me show you 5 ways you can safely overcome the fear of bending so you can regain your mobility and overcome chronic pain. First, we need to unlearn all the outdated garbage you've been told about being afraid of bending your spine. The trouble is it's really easy to believe that narrative because so many people with back pain do have more pain when they bend forward. So you falsely assume that you should avoid bending forever. First question, if the spine wasn't meant to move, why do we have well over 100 joints in the spine, including in your low back? And why are the facet joints in the lumbar spine angled specifically to allow a high degree of flexion and extension? If the lumbar spine wasn't meant to move, why hasn't it fused like the pelvis or the sacrum or the skull or other areas that need a high degree of stability and protection? Or for that matter, why isn't it just one big, long, strong bone like the femur? Okay, the first step to overcoming fear is knowledge. Second question, with this many joints in the human spine, do you even think it's possible to avoid moving these joints during daily activities? So you've been taught to hip hinge and keep a neutral spine during daily activities. So take a look at me doing a hip hinge right now. Would you say that I am keeping a neutral spine? I would say it looks pretty good, right? Well, guess what? Even when it looks neutral, the spine is actually flexing anywhere from 26 to 40 degrees, even when it looks neutral. So it's impossible to keep your spine straight, even if you wanted to. Let's talk about a straight spine for a second. What we call neutral in the lumbar spine is actually a slight backwards curve. You can see that here. So when we bend forward, we're actually not bending the spine. We're just straightening out what used to be a backwards curve. So technically, bending forward is impossible. All we really do is straighten out the spine. So these models that make it seem like when you bend forward, a disc herniation will get worse are not only inaccurate, but we have research showing that for many people, when they bend forward, it actually pulls the disc herniation back in. Long story short, don't be afraid of spinal flexion. The goal is to gradually regain this mobility over time. The second way we overcome fear of bending is relaxation. Lie on your back with your feet up on a couch or a chair. This puts your pelvis in just the tiniest amount of flexion. So this is a very easy way to start. We'll do belly breathing. You take one hand to your belly, one hand to your chest, and breathe into the belly so that the hand that's on the belly will rise when you inhale and lower when you exhale. The chest shouldn't be moving too much. The point here is to get your belly and your core muscles and your back muscles to just get used to relaxing. So the next thing we need to do is relax your core, relax your back. You spend all day tightening up those muscles. What do you think is going to happen? Of course they spasm. Of course they become tight and overprotective. We need to teach your back and core to relax. Step number 3, graded exposure. The only reason you keep tweaking your back is because you either do too much too fast or you're doing too little too long. And what happens is if you do too little for too long, your body becomes weak and atrophies, and then you skip steps, do too much too fast, and you flare things up. So don't baby yourself, but don't skip steps. How do you know if you're skipping steps? Well, 1, you need a proper, comprehensive, full body plan to give you the steps so that you don't skip steps without knowing it. And number 2 is you need safe pain protocols. We already have a video on that. If you want a plan, that's where we come in. Reach out. We're here to help. The third way we overcome fear of bending is unloaded flexion. Let's take this to the ground. We're eliminating gravity, so you don't have to be worried about compression. We can start with little pelvic tilt, or we can do a cat-cow. Whichever option you choose, start with tiny ranges of motion that are almost imperceptible. Eventually, you'll want to work towards Inhaling to lift the tailbone up and look up, and exhale to tuck the tailbone and look down. Now listen up, this is really important. Use the breathing alongside the movement. The exercise is not the magic. The magic is teaching your nervous system that this is safe. So combine peaceful, relaxed belly breathing with the movement to prevent overprotective muscle spasms. And then eventually we want to restore full range of motion. Don't compare yourself to me. I'm hypermobile. The other exercise I like for graded exposure to flexion is a child's pose rock back. Basically, you just start with a breath in, exhale, see if you can go, a couple inches back. Eventually, over time, you might be able to work your way towards 50% back and then 75%, and then eventually get your hips all the way back. For bonus points, you can try staggering the knees slightly forward and back, do both sides. You can also try taking the hands off to one side as you do the rock backs. You can do the same thing with a cat-cow. So I could, for example, take my hands off to one side and do a cat-cow with a little bit of side bending. Those little variations are a really cool way to teach your spine that it's okay to move at any angle so that it reduces fear, builds familiarity, builds confidence, and then over time you can progress to harder things. Hey, real quick, I'm Dr. Anthony Davis. If you're new here, I empower people with chronic back pain and sciatica to reclaim the active life they love. We are always evidence-based. If you want to see how we apply this information in real case studies and examples and research breakdowns with practical guidelines, watch the masterclass. The link is always in the description. Okay, the fifth way that we can overcome fear of bending is with vertical or loaded flexion. This one is really important because this mimics real life, bending over, picking stuff up, putting on your shoes. Simplest place to start is a hinged cat-cow. Take your hands against a wall, do a gentle cat-cow. Remember to use the breathing and remember to relax. To make it harder, take your hands lower or put them on a countertop and do a cat-cow from there. Eventually, you'll be able to take your hands to your knees and do a cat-cow from here. Again, remember to use the breathing to prevent your body from going into fight or flight, and just do tiny ranges of motion at first. Progress to bigger ranges of motion as you're comfortable. Then eventually, we start a Jefferson curl progression. Don't worry, we don't start here. We can start by just standing, take a breath in, and then exhale, and just slouch a little bit, and see if that feels okay. And then we stand back up, take a breath in, exhale, slouch. If this starts to feel okay, eventually you'll work to exhale, slide your hand down your thighs or maybe even to the knees and then back up. And at some point, you'll want to be able to just go as far as your body lets you go without pain or fear being the limiting factor. Again, ignore me, I'm hypermobile. And yes, it is safe to build up to using weighted Jefferson curls. You just want to make sure you do not skip steps. Be really, really patient. But let's be real, if you could do everything we just talked about in this video, do you really think you would hurt yourself just putting on your socks? There's no way. Oh, and remember, as you're working on these new things, it's totally natural to have some new sensitivity, tightness, and even a little bit of pain. As long as it's just mild or moderate and it's not getting worse over days or weeks, then what you're doing is perfectly safe. Don't freak out about it. It's going to be a little uncomfortable. That's okay. So remember, knowledge is power. We have tons of research showing that flexion is safe if you ease into it. Number 2, relax your core. Teach your muscles to be able to move a little bit and not be clinging on for dear life 24/7. Number 3, use graded exposure. Start really easy, but don't baby yourself. Push yourself a little bit over time. Do not skip steps. Number 4, which is how to apply graded exposure, is unloaded flexion. Start in a gravity-independent state and then gradually get to number 5, where we start vertical movement of the spine, like hinging and moving and doing normal life. Please remember that these progressions are just part of a full body approach to graded exposure and strength and mobility. And please remember that exercise alone is not a complete solution. If you've been stuck in chronic pain for a long time, you need to address mental health, nutrition, sleep, and lifestyle. Now, I realize many of you are still probably afraid of bending, and that's okay. We have an entire video debunking, just thoroughly destroying McGill's research and talking about all of these terrible things that you think are going to happen. Let's break it down. You want to see that video? Watch the video that's appearing on your screen right now, and I'll see you there.